This is Ravak Hoffman from Every Bit Fit, located in Scottsdale, Arizona, and welcome to my blog. Anyway, if you're watching this video, there's a high likelihood that you're probably dealing with some form of lower back pain. And as I outlined in my blog, what you will see is that I have made three distinct differentiations. The first one being sudden lower back pain, the second one being chronic lower back pain, and the third one being severe lower back pain. And it's very important that you understand the differences, and this is the reason why I'm shooting this video. The big problem with sudden lower back pain is that when it usually strikes, it usually is a situation that is either related to trauma, like let's say you're a football player and you're going for a pass and you get hit from the rear when you're jumping up to catch the pass, or you're rear-ended by a car in traffic, or let's say you've fallen down a flight of stairs. And in most cases, it's very debilitating to the point where you just can't move. The pain is so excruciating that any form of movement, no matter how small it is, will exacerbate that pain. In this case, anything that I mention in my blog as far as remedies it won't work. It's a moot point. However, there are other situations where you can have lesser forms of that, say a sudden jolt in your back that happens, let's say you're sitting in your desk all day and you're working real hard, and then all of a sudden you're called into an office meeting, you have to stand up quickly and you feel something in your lower back. And in most cases, we define that as sudden, but not severe, sudden lower back pain. And although painful, you're still able to move around somewhat. And in that instance, that would warrant getting into some of the mobilizations that I recommend, some of the constructive stretching protocols that I've outlined, and even if you're able to, if you have access to an exercise bike or a swimming pool, those kind of things would greatly improve the quality of your back comfort and would probably reduce the back pain by maybe 50 to 75% if you get right on it. The third category is chronic lower back pain, and this is the one that everyone talks about, caused from sitting at a desk all day long in the workplace. People get up, they feel like stiffness in the back, they have problems extending their spine. Because of that, they feel like they're 90 years old, or perhaps someone was sitting on the floor, they try to get up, and then they're too stiff to also straighten up. Or let's say you're sitting on the couch and you're watching Netflix for 3 hours, and then you get up to get something to eat, and that's that chronic lower back pain, as we call it. That is the form of back pain which is best treatable with the modalities that I outlined in this lengthy blog as you read on beyond the preface of it. My recommendation is that you try these out if you fall into the categories that I mentioned. If you have severe back pain, then that would warrant either going to the doctor's office, and if you can't get in to see them in time, then there are chiropractors that will see you on an emergency basis, usually within hours of a phone call. And I've been there, I've had back pain myself, and have found great relief from going in and having some manipulation and then some they call it phonophoresis, where they're putting cortisone cream on, things like that, and that helps. And then at that point, I become mobile enough where I can actually get into my own home remedies, my own exercise stretches and things like that, which accelerate the healing process of my painful spine, or your painful spine. Anyway, so the mobilizations are something that I highly recommend. I've been working with clients for over 20 years as a medical exercise specialist, now as a Czech practitioner. People have benefited from them. I watch people recover within like 2 or 3 days. I see when people don't do anything for when they have that pain, things get worse. And if they get worse, then there is that potential that they can lead up to something of greater complication that may not be holistically treatable. So on that point, you have 3 choices. You can either do the holistic method, which is chiropractic and physical therapy approved with the foam rollers, the balls, etc. You can go in and see a doctor. They can prescribe pain medicines. The only disadvantage of the pain medicines is that your whole sense of cognition and awareness and your ability to stay alert is greatly diminished. In fact, if you read the label on the bottle, it clearly says, do not drive while taking this med. It causes extreme drowsiness. So that's what you can expect. The third option is surgery, which I don't recommend, and any back doctor that has a strong sense of ethics will tell you that there's about a 50 to 70% success rate on the back surgery, and the likelihood of reducing the pain that you originally walked in is very, very small. You'll have functionality and mobility, but the pain resolution is not quite there. And you can go on forums, on spine.com, and you can look at that. You can get people's feedback on it, and you can see that the consensus is, yes, people are more mobile after the surgery, but they don't have that amelioration of the pain. In other words, the pain never really goes away. So your choices are those 3, or start doing something very constructive for yourself as far as figuring out what the cause of the problem is. I mean, there is a symptom, so obviously there is a big cause that's creating it. In most cases, it has something to do with your hip. You know, we have special tools that we use, calipers that measure the angle of the hip. There's a correlation between the way the hip glides forward and impingement of the lumbar spine. So you can have that assessed by a professional. You can also have forward head carriage. There's devices like this that measure the distance from the head to the rib cage, and there's a big correlation with the way the head goes forward, how far forward it goes. And as that comes forward, the pelvis always follows suit. That's the way the body works. And that always equals both neck and lower back spine problems. So my recommendation is, once you figure out how you're going to treat the problem as far as the symptoms of the problem, get proactive and go figure out what the root of the problem is. And that means seeing a professional, either a physical therapist or a Czech practitioner such as myself, who has a solid education on dealing with spine issues, and fix that problem. And you'll be glad that you did. If you don't, well, you are basically stuck with the ebbs and flows of back pain. As mentioned in my blog, the recurrence rate of back pain problems is very cyclical. It usually comes up about every 1 to 2 months. So you're going to find yourself either taking meds, if that's your choice, or doing your mobilization stuff, or whatever. Or, you know, like I said, the proper way to do it is actually find out what the problem is, correct it, nip it in the butt, and then move forward so you can live a pain-free life. Anyway, if you like this video and you like my blog, leave a comment down below, and also share it on social media. There's little widgets for that. And of course, if you have any opinions or comments, feel free to leave them at the bottom of the blog. Anyway, thanks for listening, and I hope you got some good information about this. If you have any further information or questions, you can contact me on the everybitfit.com website. I have a message board there, so feel free to shoot one out to me, and I'll get back with you as soon as I can. Thanks for watching.